At Axios, we are very committed to access to medicines and access to healthcare. And we work with the patients and with the doctors in the countries and with the pharmaceutical companies to make available their products. And Access to Medicine Foundation have helped us a lot in creating that environment where the companies are compelled to increase access to their products. And that helps us greatly in our discussions with them. We used the research of the Access to Medicine Foundation in 2020 to look at, for a pharmaceutical company client, to look at the gaps that were identified and work with the company on addressing these gaps so that they have a coherent strategy related to access. There was another example also where we worked with the company. It was highlighted as good thing. You know, they were good programs, and the idea was to optimize them, scale them, and make them big. So it is very important for us to have a third party that is independent and external to be able to evaluate what the pharmaceutical companies are doing or what we are doing with the companies, identify the gaps, and identify the successes so that we can scale up the successes and address the gaps. I think the companies now understand that they need to do something about access to medicine. They are doing programs that seem ad hoc programs outside their normal, I would say, operating models or business models. I feel where we need to improve things is to get them to integrate these access strategies in really their business model so that they are anchored. This is the way they do business in low and middle income countries. So Access to Medicine Foundation makes a huge difference in terms of furthering the agenda of accessibility to medicines by working with the pharmaceutical companies and pushing them to do more and evaluating what they are doing and quantifying that, which is a very important parameter in furthering access. We work with the foundation on that because we are working with the companies on these programs and make sure that actually they are delivering the impact that is expected. You know, Access to Medicine Foundation has been there for 20 years. We founded Axios 25 years ago. And both organizations have plenty of people who are very passionate about access to medicine and really want to have an impact on accessibility to medicine. And that is what actually makes us working toward the same goal and interacting quite a bit together to see how we can help each other and help the patients in getting more access to medicine. We have been learning over the years about how to do what we do better. We've been learning also and discovering more and more gaps in the healthcare system, more and more gaps also with the pharmaceutical companies. We want the pharmaceutical companies to do more, and we also want to address these gaps. So we work together to really move day after day toward more and more accessibility to the patients.